Why is your low back pain persisting? Maybe you've had a disc herniation, or been involved in a motor vehicle accident. Maybe you've just had mild low back pain and it's progressed to the point where you're living in everyday debilitating pain. Or it could be that you have no pain altogether, but every once in a while, you'll feel your low back go into this intense spasm, and you have no idea why. But did you know the low back muscles aren't like most other muscles where after enough rest, they function just as well as they did prior to injury? Specifically, one muscle, the lumbar multifidus, may require special attention depending on the severity of the injury, and today, I want to show you how to properly assess, treat, and exercise this muscle. Just very quickly, this video will take us on a bit of a deep dive into the anatomy and the research of the lumbar multifidus. If you're not interested in this, skip ahead and use the timestamps to fast forward to the assessment, the treatment, and the exercises. However, for those who want to dive a little bit deeper, bear with me on the details a little bit, as I can promise you it's worth knowing the why to the story. First, what are we talking about when we're referring to the major muscles of the low back? Superficially, we have the thoracolumbar fascia and its fascial attachments to the latissimus dorsi. Underneath, we have the iliocostalis and the longissimus muscles, and underneath that is the multifidus. These three muscles together are known as the lumbar paraspinal muscles. Other surrounding muscles are the quadratus lumborum, which runs from the 12th rib down to the pelvis, and also the posterior muscles of the internal and external obliques. All of these areas can be a driver for your low back pain, but it's your lumbar multifidus specifically that is the most interesting, as it's shown not to fully recover after traumatic episodes of low back pain. The multifidus muscle can be split into two distinct regions, the superficial region and the deep region. You'll see here that the deep fibers of the multifidus cross up to 2 lumbar spine segments, whereas the superficial muscle fibers cross up to 5. Based on the origin and insertion, or the starting and end points, you'll see here how the deep multifidus would play a greater role in those precise movements of the vertebrae, as it's reported to contribute to up to 2/3 of that interspinal segmental control. Within the multifidus, it's those deep multifidus fibers that have shown not to recover as well as the other fibers. Let's look into this a little further. Whenever we go to move or bend our low back, our nervous system sends signals to the nerves to turn on the muscles in a synchronous fashion to produce force and control. Take, for example, when we go to bend forwards or backwards, what should happen is a synchronous recruitment of the paraspinal muscles. This generates movement to the lumbar spine joints known as intervertebral motion. With low back pain, there can be a disruption of the timing mechanism of this muscle recruitment, and we can commonly observe a lack of movement where one joint just doesn't bend during motion. Here lies the problem. After an episode of low back pain, this disruption in the timing mechanism can persist even after the back pain is resolved. This can be more evident in cases of severe injury, such as a disc herniation, fracture, or a motor vehicle accident. So what exactly is it that leads the muscle tissue to be less responsive in people with a history of chronic low back pain? In the first 12 weeks following a bad back injury, with no physiotherapy or directed rehabilitation, we see atrophy, or a decrease in muscle size of the muscle fibers themselves. Then, after 12 weeks, on MRI, we begin to see visible fat depositions emerge in the lean muscle tissue, which is a physiological process known as fatty infiltration. At this stage, there are all kinds of inflammatory changes, such as thickening or scarring of the connective tissue, and the deep multifidus loses its role as a fine-tuning segmental control muscle. The fibers of the superficial multifidus and larger paraspinals tend to take over, implying a strategy of protection for a compromised deep system. In really chronic cases with bad back pain that prolongs for more than 6 months, we begin to see a reorganization of the motor cortex representation of the multifidus. What do I mean by that? Essentially, the signaling from the brain to the muscle is disrupted, and there's a lack of executive command to the specific muscles. In this case, there is a loss of precise, descending brain output to the deep multifidus, making it more challenging to recruit. As a net result, if low back pain is ignored and left untreated, we see a progressive overactivation of the superficial multifidus, iliocostalis, and longissimus, and a net inhibition of the deep multifidus as time goes on. If you think about it, if there's a lack of that segmental spinal control, the longissimus and the iliocostalis will be asked to do everything, often resulting in pain, spasms, and the feeling of the back giving out. These are the kinds of people who might be doing casual things around the house, such as bending over the sink and brushing their teeth, and then they experience this back spasm. Or maybe they're using tools at work and they're bending over and all of a sudden they've got this bad pain flare. In terms of treatment for the low back, an assessment should be conducted to identify what is driving the increased tone in the paraspinal musculature. Perhaps there are co-drivers, or areas in the body that are also contributing to the pull in the low back, such as the lat muscles, obliques, or glutes, and these should be identified for optimal results. Downtraining of the paraspinals is often necessary, and here I'm using a 40mm dry needle to elicit a motor response to help relax the muscle tissue. At home, you can certainly try to stretch or perform home release techniques with a lacrosse ball. Generally, you want to hold on to a stretch for 30 seconds to a minute, or to release it, spend at least a minute on the ball. But really what you want to do is assess the quality of the multifidus tissue itself. To test the muscle, we want to assess the quality of the muscle tissue with our hands. In prone, you want to find the multifidus muscle, slightly lateral to the bony prominence of the spine. Using your thumbs, you want to see how far you can sink the pads of your thumbs into the muscle tissues. If there is a history of chronic low back pain that is experienced more on one side, you may feel less tissue resistance on that side, and it should feel like pressing into a soft avocado. Next, you want to see if you're able to recruit the muscle voluntarily. In supine, you want to flex the hip to shorten the iliopsoas on the side of interest, and have someone place their fingertips on the multifidus muscle, just lateral to the bony prominence of the spine. Then, use the following visual cue. Visualize that the therapist's fingers are a thumbtack, and you want to precisely contract the low back by extending 1 mm away from the fingers. You can imagine a line from the backbones of the pelvis, known as the PSIS, and have them draw together, while visualizing extending away from the thumbtack. Or, you can visualize a line between your flexed hip and your low back, and as you contract, you want to feel like this line is coming together. The therapist will want to assess if there's a firming in tone, and the feeling of the muscle quality is no longer as soft. If done correctly, it might feel like this muscle is waking up. To exercise this muscle, it will take a lot of visual practice and repetition to properly connect to this atrophied muscle, so you'll want to perform this exercise 10 times for 3 sets, a few times a day. As you get the hang of this, progress to recruiting this inside lying, where you will want to use the same visual cues to achieve contraction. Here, we use the proximal limb, or the thigh, to increase the load to the muscle by gently rotating the thigh outwards. This is not a glute exercise, but rather you want to feel the recruitment coming from the low back. If this is achievable, perform 10 times for 3 sets, a few times a day. But if not, you'll have to go back to the isometric recruitment in supine until your brain is able to better connect. Like any atrophied muscle, it is challenging to build cross-sectional area through isometrics alone. You need to find ways to integrate the contraction of the multifidus into higher load movements. You can progress to variations in quadruped, such as the quadruped clamshell or the quadruped hip extension with long lever. Remember, you need to feel like the deep muscles in the low back are recruiting. With enough repetition, you can progress to more global movements, such as the squat or a rack pull, with the proper cueing of drawing the backbones of the pelvis together. The end goal is to generate the necessary hypertrophy to sustain the mechanical tension in the muscle while you move through the range of motion. With enough practice, the integration of the deep multifidus will become automatic to your movement strategy, and you won't have to constantly think about visual cueing. On my previous video of core muscle assessment, I talked about how integrating the deep abdominal fibers are important for the stability of the low back. Similarly, in a 2010 study conducted by Julie Hides and her colleagues, they found that the odds of a good multifidus contraction were almost 4.5 times higher for those who had a good contraction of their transversus abdominis. Conversely, a poor ability to contract multifidus was also correlated with a poor ability to contract transversus. Alright, to understand why that is, we have to dive even further. This is a cross-sectional diagram of the paraspinal muscles, along with the muscles of the abdominal wall. On the top right, we see the transversus abdominis, internal oblique, and external oblique blend into a common line, known as the aponeurosis of the transversus abdominis. On the left, we see the multifidus, longissimus, and iliocostalis, and it's contained in what is called the paraspinal retinacular sheath. We can think about the muscles as being the meat, and the aponeurosis and sheaths as being the sausage casing. In between the two, we have this white triangle, known as the lumbar interfascial triangle. Essentially, if there is not enough meat in the sausage casing, we are never going to create enough mechanical tension through the voluntary contraction to pull on the connective tissue triangle to generate enough stability, control, and force closure of the pelvis. So for someone who is trying to train their transversus abdominis and has a highly atrophied lumbar spine, they may have difficulties feeling the necessary tension or recruitment in their abdomen and low back. So I hope that explains the link between the lumbar multifidus and the deep core system. I know it's a little nuanced and you might be listening to a little bit more than you want to know, but if you're having spontaneous, intermittent low back pain and your physiotherapist has told you, just stay active, perhaps then this video and the assessment, treatment, and the exercises, maybe that's exactly what you need. Thanks for watching, please like and subscribe.